Hi there, my name's Tanner. I'm just going to be asking you some questions about your health history today. How are you doing?
I'm good.
Good. So, can you tell me how old you are?
I'm 18.
You're 18 and your name's Isabel. Okay, can you tell me your date of birth?
December 3rd, 2001.
And where were you born?
I was born in Indianapolis, Indiana.
Okay. And what gender do you identify as?
Female.
Okay. And what is your marital status? Are you single?
I'm
married?
single.
Okay. And what's your race or ethnic origin? Are you Caucasian? And what's your occupation?
I'm a full-time student.
Student? Okay. So what is your major health problem or concern at this time?
I don't really have any. I'm just here for...
Okay. Just here to get your health history assessment?
Yeah.
And how do you feel about seeking health care?
I don't really have a problem with it.
Okay. And what would you say your general health status is?
I think I'm pretty healthy.
Pretty healthy? And are you in any pain today? No? So would you say, like, on a scale from 0 to 10, you're at like a 0? A 0?
A 0.
Okay. And I'm just going to ask you some questions about your past health history. So did you have any childhood illnesses?
I had asthma.
You had asthma? And when were you diagnosed with that?
When I was 3 years old.
When you were 3? And what did you use to treat that? Did you use like an inhaler?
I used an inhaler.
Did you use like a spacer with it, the long tube?
When I was little, I did.
Okay. And do you currently still have asthma?
No.
You outgrew it?
Mm-hmm.
Okay, so what age did you outgrow it?
I think 10.
10? Okay, and I'm just going to ask about some of your immunizations. So, did you have an influenza shot?
Not this year. But
Not
I
this
have
year?
in the past.
And have you had a meningitis shot?
Yes.
Meningitis. What about chicken pox?
Yes.
Chicken pox. What about hepatitis A and B?
Yes.
Okay. And did you ever have like a pneumonia immunization?
I did not.
You did not? Okay. Okay, so I know you said you outgrew asthma. Do you have any other illnesses now?
No.
No. Okay. Have you had any major surgeries or hospitalizations or operations?
When I was 3, I broke my arm,
You broke your arm?
and they had to do surgery.
And how did you do that?
I was jumping on the bed, and I fell off.
And is that it?
I was in a car crash,
You were in a car crash, and when was that?
2018.
2018? Do you know what month at all?
It was in May.
Okay, and what, did you have anything serious happen?
Just some bruises on the
Some
leg.
bruises on your leg?
Mm-hmm.
Okay. So, do you have any prolonged pain or any like pain patterns?
Not really.
No? And do you have any allergies?
I'm allergic to nuts
Nuts,
and cats
cats.
and just, I seasonal allergies.
Okay. And what happens when, besides for like the allergies with cats, so like when you eat nuts, if you have ever, I'm guessing you have, what kind of like allergic reaction do you have to it?
It's an anaphylactic reaction, so my throat closes up
Mm-hmm.
and my eyes get puffy and really swollen.
Okay.
I can't breathe very well.
And are you on any current medications?
I'm on birth control.
Birth control? Okay. Do you know what kind or what dose?
I take it once a day.
Once a day?
10 o'clock.
In the morning or at night?
I take it at night.
Okay. And you don't have any side effects to that or anything?
No.
Okay, now I'm just going to ask you some questions about your family history. So we'll start with your paternal, so parents, siblings, grandparents, genogram. Start with paternal. Do you guys have any family history, such as, I don't know, heart problems, respiratory problems?
My mom's side has heart problems.
Okay. Mom's side? And what about your dad's side?
Nothing really on my dad's side.
No. And what about your siblings? Do you have any siblings, brother, sister?
I have a brother and a sister.
And how's their, do they have any history of?
Not really. My sister has an egg allergy.
She has an egg allergy? Okay. Okay, now I'm just going to go over some of the systems with you. We're going to start with your skin. So do you have any history of skin disease or any change in moles or freckles?
No.
No? Do you have any excessive like dry spots on your skin? Or no?
No.
Do you get any bruises anywhere?
I bruise pretty easily.
You bruise easy. Is it mainly on your arms, legs?
My legs.
Your legs. Okay. And for your hair, you don't have any hair loss? No. Any changes in texture? No.
Not really.
And how about your nails? Do you have any changes in texture or color?
No.
No. Okay, now we're going to move on to your head and neck. Do you have any problems with your head or neck? No.
No.
No headaches or feeling dizzy or anything?
I get headaches sometimes.
Sometimes. Do you take anything for that?
Just ibuprofen.
And how often do you get headaches? Not that often, pretty often,
Not that often.
not that often. Okay, now we're going to move on to your eyes. You don't have... Do you have any difficulty with vision or
No, I have glasses for like computer work. but
just like
that's
reading
it.
glasses or
Mhm.
okay. And when was the last time you've got your vision checked?
It was in May of this
May
year.
of this year, okay. And have you had any ear infections or noticed any discharge from your ears or anything like that? No. No ringing or excessive like loud noise that you've been exposed to?
No.
And what do you ever clean your ears at all?
With Q-tips.
With Q-tips? Okay. And how often do you do that?
Probably once every few days.
Okay, now we're gonna move on to your mouth, throat, your nose, and your sinuses. So with your mouth, do you have any toothaches or any discharge, such as blood? Any changes in taste?
Not really.
No. Do your gums ever bleed or anything?
Sometimes when I brush my teeth.
Sometimes when you brush your teeth. What about flossing too?
Yeah.
Yeah. And does that like affect how often you brush your teeth or floss whenever they bleed like that?
No.
No. And when was your last dental checkup?
I think it was in February.
In February this year?
Mm-hmm.
Okay. And how about your throat? Do you get a sore throat often or any difficulty swallowing?
No.
No? No discharge or anything? And for your nose, do you get colds often?
Just
Loose-
allergies.
Just allergies? No loss of smell or discharge or anything?
No.
No? Okay, now we're going to move on to respiratory. I'm going to start with your thorax and lungs. So do you have any chest pain? Is there any history of lung disease in your family or no? No shortness of breath or wheezing or coughing?
No.
No. And you don't have any like toxins or anything like in your home or environment where you live? You don't live? Okay. So now I'm going to talk about your heart. Have you had any heart problems at all?
I have a leaky heart valve.
A leaky heart valve? Have you ever been diagnosed with hypertension or hypotension or anemia?
No.
Nothing like that. And does the leaky heart valve affect you at all? Does it make you feel different or anything? No?
No.
You don't have any like abnormal swelling anywhere on your body? No? Do you experience any like tingling, discoloration, or pain in either your upper or lower body?
No.
No? So now for your abdomen, you haven't noticed any changes in your appetite, food intolerances, or indigestion? No? Have you ever had any abdominal pain, anything like that?
No.
No? Nausea or vomiting? No problems with your liver, gallbladder, pancreas, appendix?
No.
And when was your last bowel movement?
Yesterday.
No constipation, diarrhea, or bleeding?
No.
Do you use any laxatives or antacids or anything?
No.
No? Is there any history of arthritis or gout in your family or you?
No.
No issues with your joints? No back pain?
No.
Do you use any assistive devices, so like a cane or anything to walk or ambulate?
No.
No? Have you ever had a history of seizures?
No.
No? Do you have any history of depression?
No.
Nothing out of the ordinary? And I'm just going to ask you about some of the things you do every day. So on a typical day, what do you normally do?
I wake up at about 9 o'clock.
Wake up?
I have breakfast. And then I usually go to class. And I eat lunch. I go home. I go on a walk. I watch some TV and eat dinner. And then get ready for bed.
Okay. And are any of those activities more difficult to perform on any? No?
No.
Okay, so what would you? Okay, sorry about that. So we were talking about what you normally eat on a daily. What would you say that you eat healthy,
I eat pretty healthy.
like pretty balanced diet? Do you eat breakfast, lunch, and dinner every day?
I try to.
Okay. How often would you say that you eat out?
I try not to. Probably once a week.
Once a week? And do you have any concerns with weight loss, weight gain, or your nutrition?
I've gained a little weight since I started
Just from
college.
school?
Yeah.
Yeah, that happens. And what about your activity? So, do you exercise?
I try
You
to.
do?
Yeah.
Would you say that's daily? What kind of
Um,
exercise do you do?
I
Go for a walk?
I go for walks. I dance. Sometimes I'll go to the gym.
And how many hours do you typically sleep a night?
About 8.
About 8 hours?
Yeah.
Do you ever take naps during the day?
Sometimes.
Sometimes. Do you use melatonin or any sleeping medication?
Not really.
No. Okay. Do you have any issues with your self-esteem?
No.
No. Would you say you take care of yourself pretty well as far as like showering, eating, no problems with any of that?
No.
And what kind of social activities are you involved in? So this could be anything from hanging out with your classmates, out of class, maybe you said you like to dance. Do you ever dance with anyone?
I go to dance class. I'll hang out with my friends
Mm-hmm.
every so often.
How many hours a day would you say you hang out with friends?
Like 3 or 4.
As far as your relationships go, how do you feel about that? That can be your family, your friends, a significant other.
Good.
Good?
Mm-hmm.
You get along with them pretty well?
Yeah, most of the time.
Is it hard not seeing your family since you're up at school now?
Oh yeah.
Do you still keep contact with them at all?
Oh yeah. I call my
Good.
mom every day.
So what about your beliefs and values? So do you go to church?
I try to.
You go to church? And how often would you say you go to church?
Not too often.
Not too often. Did you go more when you were back at home in your hometown? Yeah. So I know you said you were a full-time student. Did you have any other jobs maybe back in your hometown previously?
I worked at a boutique clothing store.
Oh, okay. And how long ago was that?
Like 3 months ago, right before school started.
So, do you ever get stressed at all? Maybe you have a big test coming up or anything like that?
Yeah, sometimes.
Yeah. Do you experience like prolonged stress for a long time, or is it just,
No. It's
whenever
usually
you're
just
getting
when I have
piled
an
up?
assignment or when I have a lot to do.
Okay. And what do you like to do to cope with that?
I try and just shut everyone out and get it done. And then once I get everything done, I feel a lot better.
Good. So, do you feel safe up here at Ball State? You do?
Yeah.
You don't feel, like you have a nice. Do you live in the dorms or do you live in a house?
I live in the dorms.
You live in the dorms, so I'm guessing you have good heat. Do you take any transportation to class or do you normally walk?
I usually walk.
Usually walk. And what about at home? Any environmental situations there at all?
No.
No? All right. That was the last question. Is there anything else I can do for you right now?
I think that's
No?
it.
Okay, well, thank you.
Thank you.